take a seat. I have been waiting for you. Do you mind confirming your appointment time for me? Awesome. And then can you please confirm your first, last name, and date of birth? You know I always have to do that. All right, so it looks like the chief complaint they have you under for today is irregular periods, wanting to rule out PCOS. Yes, tell me a little bit about that. So you feel like you have PCOS, okay? What are some of the things that make you feel this way? Can go over 3 months without a period. Just very irregular. Okay. You've noticed an increase in acne. Okay. You've gained quite a bit of weight over how long would you say, the past 6 months? Okay. Any changes to your lifestyle at all? Diet, exercise modifications? You feel like you've actually been eating better and doing better, you're still gaining weight. Okay, for sure. Also notice some facial hair. Okay, understood. Has anyone ever worked you up for hormone imbalance or PCOS? Okay. Anyone in the family with history of, irregular periods, polycystic ovarian syndrome? You think your sister has it? Okay. Okay. And then as far as your medical history right now, are you taking anything? Okay. No surgeries, right? And do you smoke or drink? No, you're okay. 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 And then never had the workup for irregular periods before? You just sort of felt like they brushed it off? No, I understand. Okay. Now that's kind of the cool thing about the internet is you find out about all of these conditions you haven't heard of, and you're able to sort of kind of look back and ask yourself, like, wait, it sounds a lot like me. Like, that might be what's going on with myself. You know what I mean? Because when your hormones are off, you just feel like a totally different person. Girl, it's so true. I feel you. Okay. When was the last time you've seen a gynecologist in general? About a month ago for your PAP? Okay. Alright. And any changes to your pharmacy at all or home address? Any change to your insurance? Okay. Alright. Well, let's get a chart started here for you. Would you mind giving me your height and weight? And do you by chance know approximately what your weight was 6 months ago? Okay. And you said facial hair, acne. Do you feel any like generalized fatigue? Okay. Have you ever had a pelvic ultrasound, by the way? I don't think I asked that. No pelvic ultrasound. Okay. All right. Very good information. Now, today, are you having any urinary symptoms, vaginal symptoms, pelvic pain? Any reason for Leanna, the PA, for her to do an exam on you today? You think you're all set there? Okay. I will definitely let her know. So if it's okay with you, then we'll just get started on some vital signs. All right, we'll just start with some hand sanitizer. No, honestly, I have noticed such an influx of patients coming in specifically for PCOS or polycystic ovarian syndrome. I think what a lot of people don't realize is how common it is. It's just that it may affect people very differently. You know what I mean? Yes, and oftentimes it goes undiagnosed for so many people. It is pretty crazy if you think about it, for sure. Alright. So, oh, I forgot to ask, any recent blood work by your primary care? Just general stuff, nothing. Okay. Completely understand. Alright, if you wouldn't mind, I'm going to have you slip your arm through there. Perfect. Just rest your arm there for a second. And you could actually rest your arm on my arm here. There you go. Just uncross your legs for me, feet flat. Perfect. Okay, blood pressure is good. Let me just squeeze the remaining air out of it here. Okay, and then you're loosening it up. You could slide your arm out. There you go. Awesome. Alrighty. So, let me just pack this away for you. Sanitizer here, and then I'll do your temperature check. Anyone around you sick at home? Fever, chills? Everything's been good there. Okay. So we've got our little temperature here. Okay. Just get this going. There we go. And this is just going to go right underneath your tongue. Give it a little bit of time just to work here, so don't mind me. Perfect. Temperature is normal. So we've got that taken care of. Okay. Alright, so I think I got everything I needed. I will let Leanna, the PA, know that we're not particularly doing an exam today, but one thing that could be beneficial in ruling out PCOS or helping aid in the diagnosis is getting an ultrasound. Now, with this ultrasound, she will start with doing an abdominal ultrasound. There is a small chance that she may need to do a transvaginal ultrasound in the event that she's not able to see everything that she needs to. Kind of depends on the person and the patient, but are you okay if she has to do a transvaginal? Prefer she not, but if she has to, I completely understand that. Alright, so I am going to relay that information for Leanna, and then she will come in, kind of ask you similar questions just about your history, plans for workup, and then we could kind of take it from there. You are welcome. She'll be in shortly. Hello, how are you? Good, good. It's nice to see you. Lee, the medical assistant, was just telling me a little bit of information about what brought you in today. She was telling me that you believe that you may have PCOS or polycystic ovarian syndrome. Okay. Yep. And so let me just take some notes here. She was telling me that you've noticed 20-pound weight gain. And there's been no changes in lifestyle. In fact, your lifestyle has actually been better. Okay. She also mentioned increase in facial hair as well as acne. Okay. And then that generalized fatigue. Okay. Now tell me a little bit about your periods as far as the irregular pattern. Sometimes there was a point you've gone like 5 months without a period. Okay. Sometimes it just skips every now and then. And how long has that been going on for you? Okay. So something you've sort of been dealing with your whole life. You've just felt more tired lately? Okay. Yeah, no, when it comes to PCOS or polycystic ovarian syndrome, oftentimes, many people go undiagnosed with it their whole life. And so there are some criteria that most providers follow called the Rotterdam criteria. And they are these 3 things. The first one is what we call amenorrhea or illegal menorrhea, meaning you go greater than 3 months at a time without a period, or you get few periods in a given year. The second criteria is hyperandrogenism, meaning that either the patient, like yourself, may experience things like facial hair, acne, weight gain, hair loss, fatigue, or if we were to do hormone labs on you, it may show that you have higher testosterone levels. So it could be one of those 2 things. And then the third criteria is having polycystic appearing ovaries, or we see many multiple follicles on each ovary. And so in your situation, now keep in mind, in most cases, you only have to hit 2 of the 3, meaning we could have a patient that has polycystic appearing ovaries and irregular periods, but no testosterone symptoms. We could have a patient in your situation where, let's say you have irregular periods and high testosterone-like symptoms, but your ultrasound is normal. So not every PCOS patient will particularly have, polycystic appearing ovaries, but they could still have the condition. Does that make sense? Yeah, so in my opinion, just given everything I've gathered from your history and your, history of irregular periods and the symptoms you're experiencing, technically you would hit the criteria as qualifying for the diagnosis of PCOS. But of course, we'll go ahead and do lab work and do the ultrasound just to rule out other etiology. Yeah, no, that is not a problem at all. When was the first day of your last menstrual period? Okay. All right, well, let's get started on your exam. So really, we're just going to be doing a abdominal ultrasound. If I have to do a transvaginal, I'll let you know. No, that's okay. I completely understand. All right. So I am just going to put some gloves on. And like I said, we'll take a look, but there is a chance, you may not have cysts on your ovaries. And again, that doesn't mean that you don't have PCOS, okay? Just going to put a couple of towels so you don't get a bunch of jelly on you. Alrighty. So it's a little cold, but it should be on the warmer side. get started with your ultrasound here. Okay. Just putting your patient info in. And just kind of sit back, relax. I will let you know if I see anything. Alright. So we've got good views of your uterus there. Let's see if we can take a look. That's your left organ there. We'll get multiple views here. I'm just going to label that. I think we should be able to get all the images through the abdominal, just so you know. So we've got all the ones of that ovary. Let's move over to this side. This is going to be right over. So far, so good. Not seeing anything concerning, which is great. Looks good as well. You feeling okay? Sorry for all the pushing. You're almost done here. All the things that we need. So, ultrasound ended up being perfect. You know, you are not someone that has any cysts on your ovaries. Uterus looks good. Everything was completely within normal limits. Just patting down here. All that jelly off of you. Let me cover you up here. So, with that being said, I think the next thing I'll want to do is put some orders in for some hormone labs. Again, just to rule out other reasons for your irregular periods. And then me and you can kind of, you know, come back and meet up to go over the labs. And then for me and you to sort of discuss a game plan on what you're interested in. You know, oftentimes what we worry about in patients who have PCOS is protecting their uterine lining because every month it's not necessarily shedding. And so there are ways in which patients are able to regulate their periods naturally without hormones. Some patients who prefer to be on hormonal birth control to not only protect against pregnancy, but also protect themselves from uterine cancer. And so we'll kind of go into all those options to figure out what is the best plan for you. You know, from my end, my job is just to protect you and to keep you safe, and then we'll also do what you would prefer as far as long-term therapy. Yes, so let me just quickly write up the labs that we're going to be doing here. Do you have any questions at all? For sure, and yes, we'll definitely meet up to come with our plan. So I'm gonna have you get dressed. The girls up front will get you scheduled to get a blood draw, and I wrote over here the labs that will get going, and then we can go ahead in discussing the treatment plan for your PCOS. Not a problem at all. It is my pleasure. I'll give you some privacy here, and the girls will see you at checkout. See ya.